Hello and welcome to Hematology Horizons. Today we are live at CancerCon. This is a young adult cancer conference this year in Atlanta, Georgia. It is attended by hundreds of patients, survivors, caregivers, nonprofit, and healthcare professionals. This mission of CancerCon is to provide support and education for unique issues faced by young adults with cancer. I am so excited to be joined today by the speakers for the LLS session. Every year, LLS sponsors a session and the conference itself, and we have a session this year on survivorship. So I have Jennifer Levine, Katie Reed, and Katie Donahue with me today, and I will let them introduce themselves.
So I'm Jennifer Levine. I'm trained as a pediatric oncologist, but actually also as a social worker and an integrative medicine physician. I currently work at Children's National Hospital in Washington, D.C., and I'm the medical director for survivorship and supportive care.
My name is Katie Donahue. I'm a pediatric nurse practitioner. My specialty is pediatric primary care, but I've worked in oncology for 20 years, and I'm also at Children's National working in survivorship care.
And I'm Katie Reed. I'm a physician assistant currently at Children's National, and I work in pediatric oncology, survivorship, and I've been there since 2014.
Well, thank you all so much for joining us today. Now, what was the name of your session, and why was it important for you to present on this subject?
So our session is Filling the Gap, Transitions in Cancer Care for Young Adults. And I think we really wanted to focus on this in one way because transitions are always a point in time where information can be lost among care, and can be difficult for survivors to have a sense of where they've been coming from and where they're going next. And so there are so many challenges, but this is a particular set of challenges that really, I think, is a mystery to many cancer survivors. And so we want to try to lift a little bit of that mystery.
So can you tell us some of the highlights of your presentation?
Yeah, we'll be highlighting a number of transitions that occur along the entire cancer survivorship trajectory that are going to be important for really all in attendance, addressing a wide audience. And we'll be doing so by way of a presentation, but also a dialogue, really encouraging some feedback from all of those presents on their experience, and hopefully giving everybody some support as they transition, no matter where they are.
Now, each of you are doing separate parts of the presentation. What are each of you presenting on?
So I'm going to be talking a little bit about the big overview, where the transitions can exist, talking a little bit about what we know, but also recognizing there's a lot we don't know. And I think to Katie's point about the dialogue, we find that it's very helpful for survivors and patients for us to hear their stories, hear their advice, hear their experiences, so that we can better integrate what we're doing for and with them.
Right.
We'll also be highlighting the transition coming off of therapy and into those first couple of days, weeks, and months after the primary therapy is ended. And, what are the issues, what are the feelings, what are the emotions, and, providing support for, survivors and education on ways that they can transition successfully through that period of time by way of education about important needs as they transition, and talking about shared care and how to collaborate with their primary care providers, their oncologists, in being present and being advocates for themselves.
We're also talking a little bit about transitioning from off-therapy oncology to survivorship, which is another transition that can sometimes be difficult, and how important a treatment summary is, and understanding your treatment as a cancer survivor, and also how to be your own advocate in healthcare, and how to stand up for what you feel is right and ask questions along the way.
Yeah, that's really great. And your presentation actually inspired us to make a theme for our booth. We are at the LLS booth today, and so our theme is Roadmap of Survivorship. And so we really wanted to take their presentation and really put it into a graphic here, and all the different points that a survivor may hit along the way, and all of those transitions. There's so many, even if you're not at that pediatric to adult age or aging out of the AYA space. There's so many transitions in there and so much uncertainty. And so I think it's really great what you're presenting on today. Now, our final question, what message do you want people to leave with after your presentation?
I want survivors, current cancer patients, everyone who listens to us to know that transitions don't have to be scary. If you're informed about them and inform your providers about them, they don't have to be scary. And hopefully we can inform you enough that you feel better about transitions.
Communication with your treatment team is very important. Yes. Any other message?
Honestly, just want to thank you all at LLS for all the work that you do and for inviting us to be a part of it, because it's such important work and so beneficial for the whole survivorship community.
Well, thank you all so very much for joining us today, and thank you all so much for joining us on this latest episode of Hematology Horizons. Please be sure to check out our podcast that we will be doing from CancerCon and also on the roadmap to survivorship, and we hope to see you next time. Thank you again.